New numbers come out from a survey on prescription painkiller and heroin abuse in our area.
On average, 2 people in our region die from an accidental overdose of one of these drugs every day. Medical reporter Liz Bonus is here now with new hot spots of concern and what healthcare providers say may need to be done to save lives. Liz.
Hey guys, good evening. We haven't seen the worst of the heroin epidemic. That is the latest from this survey. It was recently conducted by Interact for Health. They are a group which provides grants to nonprofits to help improve the health of our community. Well, they recently took a closer look at especially Kentucky numbers, where hotspots for heroin are shifting from outer rural areas to right here in and around northern Kentucky.
Northern Kentucky is the epicenter for the heroin overdose and the heroin abuse.
It crosses all rivers and boundaries, but Dr. Odell Owens of Interact for Health says one of the things this survey has confirmed:
heroin is a middle class. It is a middle class, predominantly 96% white abuser.
As law enforcement has cracked down on prescription drug abuse,
when you cut down on prescriptions, that then drove the people to the heroin.
the team here says if this information is sounding all too familiar to your family and your life, they do have a few recommendations. Some of those are things we can do one-on-one for those we care about, and some of those are things we need to embrace as a community that are quite controversial. Dr. Owen says identify the hotspots of the most drug activity.
Most drug activity, where you're seeing a lot of the overdoses.
Give those areas the resources of Narcan and needle exchange programs. If you don't, disease will spread.
Our early data showed that 49% of people coming in for needle exchange are already positive for Hep C.
This survey, he says, is simply proof heroin is everybody's problem.
I don't think we're seeing the worst of it. They're not going to experiment. They're going to put it with cocaine. They're going to try to do something probably with crack. It's just the nature of the business to try to always be able to say, I can give you your strongest high.
Dr. Owens may be right. Based on this report, almost a third of those surveyed said they know someone who abuses prescription painkillers right now. And the number of deaths from drug overdoses in Kentucky is now 5 times higher than it was a little more than a decade ago. You can read the full Kentucky Issues report on our website at local12.com.